It is just a huge honor to be podcast interviewing James W. Gabhart II, DMD.
Thank you.
Here at the Kentucky Dental Association. He is proud to provide superior dental services and a pleasant atmosphere to families throughout Hardin County. An undergraduate of University of Kentucky and a graduate of University of Louisville School of Dentistry. Dr. Gabhart and his family have lived in Elizabethtown for more than 20 years. He and his wife, Kimbra, have 3 children, Kaylee, Garrett, and Jessica. He is a leader in his profession and community, serving professional organizations, teaching dental hygiene, dental assisting to students at area colleges, and volunteering his time to a number of community organizations. He is also a part-time farmer, and in his spare time, he enjoys cooking, gardening, and spending time with his family. My gosh. So how's dentistry doing for you?
It's great.
And what year did you graduate?
94. This is our 25th anniversary this weekend.
Nice. Well, on 25th, 25 years, you said?
Yep. We're having our reunion tomorrow night. Louisville.
Where? At your dental office? Or
no, we're
where?
doing it here at downtown Angels Envy. They do the reunion classes, the different reunion classes.
Oh, you mean the reunion for your dental school?
Dental school, yes.
Oh,
25
wow.
years.
Well, this is awesome because most of the people listening to podcasts are millennials. A quarter of them are still in school. They love hearing from people who have done this, 25 years.
Right.
How has dentistry changed in the 25 years?
Well, I guess the big thing is corporate coming in and more businesses combining, and then more specialization, I would say, as far as, general dentists coming out don't do everything. Like, I guess we did more full service. That would be the biggest differences.
And what advice would you give to the young kids coming out of school? Do you think do you think that when you and I got out in 87? What year did you get out?
94.
Okay. Do you think we were in the golden years?
Yes.
That it was easier
Yes.
than those coming out today?
Yeah, but I still think it's one of the best professions to be in. We're still the most trusted. Income-wise, we're one of the best out there, still in the top 3. So, I mean, it's a great profession. I think that they just get scared. They just need a little more experience, confidence, and I would say get with good people in your area, older dentists to mentor you, and if you're not getting that from somebody, find somebody that can do it for you. And if you get with those people, they'll share, and that's what you need.
But they seem to be afraid to walk across the street and knock on the door because they think you're going to think, well, I'm competing with you because I'm in the same town you are. Are you in a small town?
Small town, yeah.
How far are you? Where are you at?
45 miles from here.
45
South,
miles.
yeah.
Are you on the river?
No,
Yeah.
central part of the state, just direct south.
So what's the population?
Population? The county's about 90,000.
Mm-hmm.
City's about close to 30, but adjoining cities around us, we draw from about a 90,000.
So what would you say to her? She's just afraid to go meet the dentist.
I think a lot of the young people do. Yeah, they come out and they think they got to go it alone, and you can actually go to different offices, and sometimes you'll get feedback, sometimes you won't. But a lot of the older dentists really want to have younger ones come in and meet them, go to lunch, talk about practice, and help them out.
Yeah.
And I've seen a lot in our area that have retired, and basically they just walked away from their practice too, because there was not anybody coming out that wanted to get a small single person practice. I don't know if it's they're afraid or...
Yeah. They're walking away from all the time on Dental Town. They put their practice up for sale. They're in a town of 2,000. They were doing $1 million a year, taking home bank. And after 2 years, just close the doors and walk away. I mean, it happens all the time. So a small town is an illiquid, illiquid. Especially the millennials want to live in Nashville, not a small town.
Bigger cities. So what do you think's going to? Let me ask you this: what do you think's going to happen in the next 10 years as far as the, private practice and the younger group coming out, the new graduating classes? What's going to happen with them? What do you see happening 10 years from now with that group?
Well, the one thing I see is my first big move was to become a dentist. Ride the sovereign wave of dentistry, and then the next big thing I saw was the internet. Moving 94 to 2000, and we started Dental Town. And now I think the next big thing is absolutely artificial intelligence with cloud computing, the Internet of Things. America just had its first driverless semi-truck, pick up a load on I-10 in Los Angeles and drive it. I-10 goes all the way to San Francisco.
Yeah.
The alternative is to sail 2 weeks south, pay $100,000 across the Panama Canal and come back up. And that driverless car autonomy is going to probably get rid of 25,000 truck drivers a month for years. And I see dentistry as it's all hands-on. Mm-hmm. Like Amazon's destroyed everything that you can sell in a box. Like all the stores, retail stores, if you're just selling a dress or shoes or something that go in a box, they're gone. And what's left? Well, you need a human to cook a food, to cut your hair. Dentistry is all surgery. Mm-hmm. Medicine, 90% of medicine can even be threatened by AI. Your pills, your tests. In fact, AI in medicine does a much better job than a physician. They're error-free. And I think dentistry is hands-on surgery. Artificial intelligence isn't going to replace you. You will have a high-income job. Dentistry, I think, has some of the greatest future prospects.
Yeah, I do too.
I mean,
let me ask you something else. I saw you speak in Vegas. It's been years ago at TBSC, and you were talking about GPs placing implants. And the analogy you gave was taking the square peg and putting it in the square hole, the round peg, putting the round hole. Come on, guys, you got to do this. I started doing implants, and in abundant bone, it's not that difficult, just like you said. So I learned early on doing it that way. Now the kids coming out of school, I feel like they're a little bit of a disadvantage because they're told you have to have so much technology. You have to have a cone beam. You have to have a guided delivery system. You have to do surgical, placement. And so somebody brand new, if they've never done it, if they have this expectation, hey, I got to spend how much money to be able to do implants? Well, I'm not going to do it.
Well, a couple of things on it. When you go around the world, the dentistry is a very homogenous organization around the world. They have the same issues in Tokyo, Paris, London, and Louisville. And the only fees not touched by insurance, the insurance not setting a fee, is orthodontics and implants. Mm-hmm. So when you go to Tokyo and Paris and London, where the government only pays you $100 for a molar root canal, mm-hmm. they don't do molar endos. They just pull them and do an implant. And so a lot of them use their insurance base population. If they can convert one person a week to clear aligners, ortho, or one implant a week, they're making bank. And if you look at all the legends in implant dentistry, Carl Misch, all of them, their first 5,000 to 10,000 implants were placed on a pano. And if you're if you're a surgeon now, and if you don't want to get into blood and guts and you want to place an implant without any blood, and you think you're going to take a CBCT, make a surgical guide, and have a robot come in and all that kind of stuff, that it's not going to work. At the end of the day, you're going to need to be a surgeon. You're going to need to lay a flap, and you can place an implant without all of this super fancy, sophisticated stuff. It's the people selling the machines that are going to make you believe that it's standard of care, when I guarantee you there's not a lawyer that can even come on this show to really even explain what standard of care is. It's such a subjective thing. But are you placing implants?
Yeah.
And are you liking it?
You led me to it.
Well,
hey.
Awesome.
I love it. It's very rewarding.
Share your journey. What implant are you placing?
Right now, BioHorizons is what I'm using the most.
Out of Alabama?
Yep. I went to the AIE Institute in Bessemer and did their part of their CERT
The AIE
program.
Implant? Where was it at?
Alabama. It's in Bessemer, Alabama. It's the one they're associated with BioHorizons. I should know this.
Huh.
I'm drawing a blank.
So it's called the BioHorizon, or what is it? What'd you say? BAE implant?
Let me look it up here. Look up Bessemer, Alabama. I'm drawing a blank on the names right now because you got me under pressure, man.
Implant Institute. Let's see how good Google is. Alabama Implant?
That's it, McCracken. There we go.
My gosh.
Dr. McCracken.
Sergey Brand, Larry Page, you guys are still doing it. Oh, McCracken Implant. Mm-hmm. Oh, absolutely. Mm-hmm. I should have known that one. So you went to his institute.
Yep.
And how did that go?
Wonderful. They put you in, do the training, treatment planning, and then you get in and do the surgeries. And you get the surgical experience. Unbelievable.
And he's got a DDS and a PhD.
Mm-hmm.
That guy's an intense dude.
Yeah. You need to have him on your show.
Well,
love him.
I have asked him to be on the show. Michael, you hear your own students. Yeah, tell him. Well, I'm sure he's busier than a one-arm paper hanger. But so you went down there and tell us about it's the Alabama Implant Education.
Mm-hmm.
And when did you go down there? How many weekends was it?
Well, we do a didactic course first. I did that up 3 days. I think it was in Cincinnati, and then went down there for a 3-day surgical. And when you go to the surgical, basically they let you say, most of them are brand new and hadn't placed any implants. I'd been placing implants before that. And I'd gotten with Tony Feck out of Lexington, who does Osteo Ready, which now is, I think, a little implant company. And that's how I got started.
Yeah.
And that was a weekend course that gave me experience and got me actually starting to place to begin with. And then when I got down there, basically, like I said, I want to do, sinus lifts, immediate posterior implants.
Wow! So you want to be very so now you could
tell them what you wanted to do.
So are you using a CBCT now?
No, I'm shopping now.
Yeah.
So I haven't.
And what did Dr. McCracken say about
They all said the same thing. Is basically you can practice without them, but boy, it's nice to have them. So
they're saying it's a luxury item.
No, I think it helps you clinically for sure.
But I mean, for a simple routine. I mean, at the end of the day, you have to make Carl Misch place 5,000 implants.
And if you got abundant bone, it's like putting a nail in a 2x4.
Right. So what are you trying to do them all? Or are you
just try to take care of my patients, what they need. We've gotten more into some full arch stuff. We're replacing, doing extractions, PRP, PRF grafts on top of that, multiple implants, immediate denture with sedation, then have them come back and once the implants are healed, doing a implant retained. But I'm doing removable, mostly removable, not fixed.
But you're probably old enough to remember the subperiosteals, the Ramus frames. I mean, my gosh, they've come a long way. They've come a long way. Mm-hmm. Are you doing? Who is the most likely to get an implant? Is it someone who has all their teeth that lost a first molar? Is it someone edentulous to get dentures on two?
Ours our practice is generally somebody comes in, breaks a tooth off that's maybe endodontically restored for years. There's no tooth structure left. Do an immediate, or molar tooth that fails, same situation for whatever reason, large restoration, caries, fracture the root, take it out, let it heal, place it. So mine are more single,
It's more single tooth.
It seems to be.
And those are easier cases than a subperiosteal or a Ramus frame or any of those. One thing I've noticed in the insurance data is the number of apicoectomies has just dropped off. It just plummeted to almost nothing. So it looks like the market of restoring a failed endo has massively gone towards implants. What would you say to a young kid who's kind of scared? They're like, they got $284,000 student loans. They wish they could do that, a broken tooth, place an implant, but they're just scared.
Do it, kind of like you said. Tell, show, do. Go watch one getting done.
Yeah.
See it happen. Ask questions. Treatment plan one, and do it.
Yeah, that's what I think. Carl Misch was so helpful for me. I was squirmish and afraid, and then I'd walk down to him, and the weirdest thing I remember about Carl Misch is, he'd lay a flat from corner to corner, and half the time he was looking at me. It was kind of like one of those drivers, like, stare at the road. Why? I remember telling so many people over the years, I'm not going to talk to you if you have to look at me while you're driving. And Carl would be sitting there talking to you, and he'd be looking. Yeah. And it was like, I felt like I went to Vietnam and then came back home, and now I have a BB gun and got to, go target practice. And so you get so exposed that it numbs your fear away.
Yeah.
So are you doing an implant a week? How much is an implant?
When we need them. I don't have goals or anything. It's like somebody walks in and needs a full arch case. We talk about it. And we got a price set for bundling that includes everything. And then if they're with it, they do it. If they're not, we can make a traditional denture.
And
what the patient wants.
And what are you most passionate about today? What's got you excited about dentistry today?
New stuff. I just started Invisalign that I've never done, so that's been new for me. So I'm learning, looking at my clean checks and stuff, how to actually do ortho. That's kind of new, and so it's basically try to do something new every couple of years. We brought in implants, we brought in sedation, we brought in Invisalign. I got doing more complicated, I'll say, root canal posteriors that I was kind of away from for a while. So it's just getting an interest in.
So where did you go for the root canal training?
I went to a course that was with the Pro Taper Diamond Gold or something.
Pro Taper, yeah. Tulsa Dental,
and of course somewhere in got one of their new systems, not the reciprocating. The one before that is the one I use.
So who started Tulsa Dental was Ben Johnson at Tulsa, Oklahoma, and he sent us the oldest video of a root canal ever done. It's over 100 years old. Have you seen that?
No.
Oh my God. It is, just go to Dentaltown and type in oldest, or even YouTube. Just go into YouTube on Dentaltown. But it's amazing how things really haven't changed in 100 years. I mean, it was still about rubber dam, cleaning, shaping. So you're doing sedation.
Yep.
Where did you get training for that?
The Docs group.
Course?
And that's Feck also. Tony Feck is big into that. Lexington, and they do it, I guess, nationally. Of course, state to state, it's different regulation-wise, and they teach you, I think, what is going to be an efficient, but more importantly, a safe way to do it. I've seen, numbers on some of the kids who have issues, and I don't treat any children at all, sedation-wise. But a lot of times it's, toxicity from anesthesia in a lot of these cases. And it's just simple. It's like you got to know baby weight, 3-year-old weight, 5-year-old weight, and how much can they have, and don't go past it. And I think sometimes what will happen is a kid gets in there to get sedated, unfortunately, and they're given too much, and they're trying to do too much at once.
Yeah, Arizona, a dentist just lost a child because they were doing four quads.
Right.
The hygienist went in and numbed the patient. He did not know that. So he went in and numbed 4 quadrants again. But the other thing that stood out in that case is that, every time you go to a physician, the first thing they do is they weigh you, take your height, your blood pressure. And in dentistry, what % of dentists do you think weigh their patients or get their height and take their blood pressure? Before sedation.
It's not very high, for sure.
I know, and that's that.
Or even the anesthesia part. We got a
don't
little.
You think that would be a practice builder? I mean, that you're going to if someone was talking to their wife and they said, I thought I saw a floaty, or I don't feel right. Well, you're getting a cleaning next week. They always take your blood pressure when you go in there. Do you think it'd be a practice builder if you did what they always do?
Sure.
And it's always the assistant. I mean, they sit down, they put an automatic cuff, they put a little deal. I mean, it doesn't take them very long. But then so you're not afraid of the IV sedation?
We're doing oral. I'm not doing IV, and I'm trying to decide if I want to get into that at all. So the oral, no. I mean, I've got the reversal drugs. I had a background in respiratory, so I'm familiar with airways, and we've got all the emergency equipment, AEDs. So that's another thing. When we got our AED, it's like, think of how many practices don't have an AED, and you look at the risk factors of like cardiac issues and things when you're giving some of these drugs to patients, and there's a normal percentage of the population out there that's at risk, and then it really increases some of the procedures we do. So, I've been on the, like, simple as the AED, how hard is it to get one of those and teach your team to use it? But a lot of practices still don't have them in their office.
Yeah. And do you have one in yours?
Yeah. And do the training.
And how much money was it?
The AED, probably, I don't know, $300 or something. I mean, it's not much.
Not much.
To save one person's life, how much is it worth?
Yeah.
Right?
Well, it depends. What if it was your father? What if it was your father-in-law?
Oh, he would definitely outsave him. He's a good man. He is a good man.
All right. So what advice do you have for these millennials coming out of school? They got $284,000 in student loans.
Don't worry. Don't worry so much. You're going to be fine.
Yeah.
If they got a good work ethic, meaning they're willing to work a week, not 2 days or 3 days, and don't get too financially unstable right off, they're going to pay their loans off. They'll do fine.
The neatest thread I've read on Dentaltown in a long time was if you know what you know now, and you graduate in dental school, what would you do differently if you knew what you knew now when you walked out of dental school? What would you have done differently?
In my time frame or now?
In your time frame.
My time frame.
So if you graduated from dental school, knowing what you know now and looking back at what you did, what would you have done differently?
I would have done a lot of stuff the same. I think the only thing different, I went into a group practice and I stayed in it for 13 years. I maybe would have gone on my own sooner, but then again, I got a lot of experience from them. So I mean, maybe I would have done an AEGD or some surgical training right after school. But of course, that would be something else. Get more training after we got out immediately.
So you were 13 years in a group practice, and now what? How many?
Solo for 20
12?
or 12, yeah.
12.
Whatever comes to 25.
Yeah. So God, wow, 13 in group with 4 people, 4 dentists.
Three total.
Okay, so half of your career with 3 group, and now half solo. What are the pros and cons, and which one do you like better?
I like the solo better now. But my daughter actually graduates this year. She's a senior. So I'm going to become a group practice next year again.
She's going to come and join Dad?
Yeah.
What an honor that she...
that was one of the cool things about my
mentor.
Graduation year, 1994. My daughter was born that's going to end up coming back in my practice that year, same year I graduated.
Wow, I mentored my 4 boys, and now they're all successful drug dealers all around the world. So that's going to be a great feeling to have your daughter. So what do you think of that?
I love it. I mean, because I'm at a point that, it's really, the volume's there, but my body doesn't need as much of that pace that I'm running.
Yeah.
So I'm looking forward to having, and all of them had their pros and cons.
So, this is Dentistry Uncensored, so we'll ask the tough questions. Lawyers always recommend when you get married, you have a prenup, but dentists don't do it. They recommend if you're going to have a partnership, you need to have it in writing. But when it's family members, a little girl's never going to go say, "Dad, I need a prenup. I'm Daddy's girl." Are you going to have a written contract?
Yeah. I love all my children, and I've told them all. I said, "Here's what happens: you all get a third of whatever this is. There's 3 of you." So when she comes in, because we had the Thanksgiving talk when we're all Thanksgiving, it's not like, "Hey, you're coming in, you're getting the practice." She has to buy into the practice, and I try to do it, structure it to where it will be good for her, it'll be good for me, but especially it'll be good for her. But in another 5 or 10 years, when she's ready to bring somebody else in, and I'm wanting to slow down a little more, hopefully, the same contract will still work. So it'll be good for the one coming in.
And who did you get to write this contract? Was it?
I'm doing it right now.
But did you get someone who only does dental contracts, or is this just a lawyer?
I'm in the process of she's coming in next May or June, in the summer. So that's what I'm doing right now. I'm going to different companies and seeing what they offer. And
because I've noticed that there's so many nuances in dentistry that when people get someone that only do dentistry, they really get good advice. But if they sit there and say, "Well, my neighbor's the best lawyer in town," and their neighbor lawyer, so it's someone that
it'll be with a dental related.
Well, I'm so proud of you that you got a lawyer in between you and your daughter to get this writing out. Because think of the most. Prince died without a will. Aretha Franklin died without a will. I mean, some of the smartest, most successful people out there, their everything ends up in probate, so if when you're going in with family, it's especially important to have a contract with an exit strategy because you don't want to walk away from something over business and then lose your mom and dad relationship. Does it scare you or your wife having a child working for you?
She was the one kid that growing up, though, she was always at the office. If I had to go up for emergencies on the weekend, come on, let's go. She would come up there at 5 or 8, 10, up through middle school, high school, take her, come up and do suction in and clean the room up when we were done. I'd take her and get her McDonald's Happy Meal or something.
Wow.
So she's been around it for a long time.
Thanks so much for coming by and being on the show. How's the Kentucky dental meeting going for you?
Good. It looks like it's a little bit bigger this year, so I like to see that.
A little bit bigger?
Hey, and keep doing what you're doing. I appreciate it, because things that you said to me, when was that you were in Vegas? TBSC. What year was that? You've got a good memory.
That was the Maddow brothers.
Yep.
I spoke. I'm the number one speaker.
Yeah.
I think I spoke at 9 or 10 of their meetings. It was basically every year, which is a fun because I live in Phoenix. It's a fun little drive. I always took my 4 boys. I love the Maddow Brothers. That's a great show. But
I remember a lot of that stuff you said from back then. So
all
it
right.
still rings true. Thank you very much.
Congratulations on
Thanks
your
for
daughter
having me.
joining you, and best of luck with that.
All right. See you.